Hello students, welcome back to the biology class. In this session, we shall discuss the chapter Health and Diseases. First, we shall look into the meaning of what actually health. Health is defined as a state of a complete physical, mental and social well-being that enables one to lead a socially and economically productive life. So the meaning of health is, physically, mentally and socially the person who is very strong and he can able to lead an economic and social productive life is referred as what we call health. Now to the present scenario, this chapter makes you a very good knowledge getting chapter. And a person is said to be unhealthy means it has to show certain characters in the body. If the person body shows all these features, then we say that a person is in healthy condition. Let's see what are those features the healthy person has. Number 1, absence of any infection. He should not have any infection. Absence of any hereditary defect. Absence of diet, insufficiency and imbalance. That is, he has to take a proper amount of food. That is what we call balanced diet. Absence of mental problems. He should not have any mental stress. Complete physical fitness. Freedom from psychological tensions. Absence of physical deformity means it should not have any organ damage. Congenial surrounding. There should be a what we can say the good environment surrounding him. So all these conditions favors, then we say a person is in a good healthy condition. Now at the same time, if the condition worse or if the health is not in a proper way, we say that it is a health failure. What are the reasons for the health failure? Why the health fails? The reason is here. It is because of certain factors. What are those factors? Number 1, physical injuries. Second one, environment also plays a very important role for the health failure. Environment means which includes physical environment and social environment. Permanent deformity, mental trauma persists for a long time. After effect of contamination of food and water resulting in number of infectious diseases. Diseases caused by overcrowding, that is what today present scenario's condition. Increased number of pests and vectors, personal unhygiene. So all these are some of the factors which makes the failure of the health. Here physical environment I use the word which includes heat, humidity, storm, cyclones, floods, droughts. That means it is because of disasters. It is because of natural disasters or environmental problems also results in what we call health failure. Next, once the health gets failed, we say a person is having what we call disease. Now let me see what's the meaning of disease. Disease means being uncomfortable or discomfort. It is a condition of derangement or disturbed functioning of the body or its parts. So if any organ fails to perform its function, then we say the person is affected by some diseases. So diseases are diagnosed with the help of symptoms and signs. Then look into the meaning now. What is the symptom and signs? Appropriately we say that both the words will give a clear meaning, a same meaning it gives, but in a different context. So let's look into the meaning of the symptoms and signs now. First we shall look into what actually the meaning of symptoms. Symptoms are manifestations or evidences of the presence of disease. Symptoms do not give any exact cause of the disease, but we can say the person is having so and so disease if he shows the symptoms. Say for example, cough, cold, headache, fever, wound with pus, loose motions, all these are considered to be as symptoms. So based on these symptoms we can say the person may have so and so disease. For example, if a person is having headache or a fever or a cold, we say normally it is flu or viral fever, like that we able to say that one. So the symptoms will tell you that the person is having so and so. The best example I can quote again to the present scenario to come for that, corona. So when we say corona, if the person should show certain symptoms, say for example, he should have again the fever, it should be there, or persistence, running nose, or if we having cough or cold. It says most of the cough, cold, fever is all viral symptoms, no problem. But today's scenario also tells that if these symptoms will have in any one of the person, or in addition to this, if persons are unable to taste the food, if the oxygen level is going to be decreased in the body. So all this tells you that the person is suffering from so and so diseases. If person is having low oxygen level, if the person doesn't have the ability to taste the food or smell the food, or he having running nose continuously or fever, then we say the person might have suspected that he is having contact with corona, like that. So like that, we can, by looking into the symptoms, we can say the person is having so and so disease by looking into the symptoms. Signs are definite indications of the diseases. On the basis of the symptoms, physicians search for the definite clues or the signs of the disease. For this, they use certain instruments and even go for the laboratory test to pinpoint the cause of the disease. So signs are the definite indications. We can exactly say, hey, person is showing like that, so he may have this particular disease like that. So, and for signs, they go for laboratory test also by by analyzing the report of the laboratory test, and by using certain instruments, they pinpoint the signs or cause of what we call diseases. Now, these diseases are classified into two major categories based on the durations, or what we can say several factors. What are those? One is acute diseases, another one is chronic diseases. What is the meaning of this duration? If a person is suffering from any type of diseases, how long the disease is retained in the body? Depending upon that, we say it is acute and chronic. What are acute diseases? Acute diseases are short duration diseases. It does not damage any organ. Soon the patient recovers and begins to lead a normal active life. Example is diarrhea and typhoid. Whereas in chronic diseases, they are the long duration diseases. It damages the organs. The recovery is seldom. We cannot able to say the recovery can happen it completely, even after the treatment. And the patient feels tired all the times, and their chronic diseases may there in the body till the death of a person. Example, tuberculosis, diabetes, hypertension, etc. Now, diseases can also be classified into further different categories like congenital diseases, acquired diseases. Congenital means by birth, acquired means after the birth, because of other factors, of environmental factors or any other factors also contribute the disease for that. Now again, in acquired diseases, as I told, it has been further divided into two types. One is communicable diseases, another one is non-communicable diseases. Communicable diseases are also called as infectious diseases. Non-communicable diseases are called as non-infectious diseases. So communicable diseases includes bacterial diseases, viral diseases, fungal diseases, protozoan diseases, helminthal diseases. Non-communicable diseases includes the degenerative or metabolic diseases, deficiency diseases, say for vitamins deficiency like that, if any mineral deficiency happens. Allergies also comes under the category of non-communicable. Cancer and some injuries also comes under the category of non-communicable diseases. As I already discussed now, first we shall move on to this congenital and acquired once again. Congenital means, as I told, they are the diseases which are present since birth. And these diseases are caused due to the defective development of the embryo or defective inheritance. Example for this is hair lip, hemophilia, color blindness, etc. For acquired diseases, as I told, those diseases which are caused after birth, and depending upon their ability or inability to spread from one individual to another, acquired diseases are of again two types, that is infectious and non-infectious diseases. Infectious diseases, as we know, they are also referred as communicable diseases because all these diseases are actually caused by microbes and pathogens. So those diseases which are caused by pathogens are called as infectious diseases. Say for example, bacteria, virus, fungi, etc. And these communicable diseases spread through different medias like air, water, contaminated food, insects, etc. Example for the category is tuberculosis, malaria, diarrhea, etc. Again, non-infectious on the other hand are the diseases which are not caused by any microbes. For example, high blood pressure, cancer, dwarfism, anemia, goiter, all these are caused by certain genetic factors, not through the pathogens. Yes, now first we shall look into what we call bacterial diseases in detail. Now this flowchart will tell you that what are the diseases basically caused by the bacteria. So here the bacterial diseases includes cholera, diarrheal diseases, pneumonia, diphtheria, whooping cough, tuberculosis, anthrax, tetanus, plague, leprosy, typhoid. All these are some of the examples for the diseases caused by the bacteria. Now let us look into certain again diseases and their causative organisms and which organ that particular disease is going to be affected and how the disease is going to be spread and what are the symptoms of these diseases. If you just look into the certain few diseases, if I quote here, like example, you can take cholera. Cholera is a bacterial disease which is actually caused by a bacteria called Vibrio cholerae, and that particular bacteria affects the intestine, and this disease is caused through the contaminated food and water, and symptoms are severe diarrhea and dehydration. Similarly, if you go for the plague, is actually caused by one more bacteria called Yersinia pestis, and the infection is the lymph nodes is going to be affected, and transmission, how it is going to be transmitted is through the rat and through a vector. The rat is carrying that particular vector, and through that particular rat this particular disease is going to be spread, and the symptoms are the fever, headache and the swollen lymph nodes. Again, another important thing is tetanus, commonly called as lockjaw, which is caused by a bacteria called Clostridium tetani, and the infection is the muscles is going to get affected, and the mode of transmission is through wound infection, and the symptoms are rigidity of jaw muscle, that's why it is called as lockjaw, increased heartbeat rate and spasm of the muscles of the jaw and face. If you look at the typhoid, the organism name is Salmonella typhi. Again, the site is intestine, and mode of transmission is through contaminated food and water, and symptoms are headache, abdominal discomfort, fever and diarrhea. And again, tuberculosis caused by the Mycobacterium tuberculosis and affecting the organ lungs. The mode of transmission is droplet infections through that, and the symptoms are thick mucopurulent nasal discharge. See, now you can see certain shapes of the bacteria with the names of the organism. See, some of the organisms are given here, that is Clostridium tetani, which is going to cause a tetanus, Streptococcus pneumonia, which is going to cause a pneumonia disease, Treponema pallidum is a bacteria which is going to cause a sexually transmitted disease, Vibrio cholera, which is going to cause a disease cholera, Salmonella typhi, again typhoid, then Helicobacter pylori, which has caused some intestinal problem diseases. So all these are some of the shapes or the bacteria which is going to cause certain diseases. Next, move on to the next important type of diseases is the viral diseases. Now here we can have different names of the viruses are shown here with their what we can see the pictures. The very first virus to the present scenario condition is the coronavirus. The shape you can see: rhinovirus, parine influenza, adenovirus, herpes, hepatitis B, mumps, measles, astrovirus, rotavirus, smallpox virus, HPV, that is human papilloma virus, HIV, that is human immunodeficiency virus, rabies virus, norovirus. These are all the different viruses which is going to cause certain diseases. And some of the names of the viruses are actually given based on the diseases what actually they are going to spread. For example, you can look into here coronavirus. As you know, it is actually causing the disease corona. Then we can have one more example here is herpes, which is going to cause the disease herpes. Mumps, again it is again the disease name. Hepatitis B, again it is a disease name hepatitis. Like then HIV is a virus name which is going to cause the disease AIDS. Then rabies virus, in the name itself it is the name of the disease is there, which is known as rabies. So like that you can go through here. Next, some of the human viral diseases, again you can look into here. Some of the common human viral diseases are common cold, influenza, AIDS, chickenpox, hepatitis B, like that. For common cold, the body which is going to be affected from that one is sneezing, sore throat, fever, headache, muscle aches are going to happen. These are the symptoms you are going to see here. And transmission is through the contaminated objects and droplet inhalation. Influenza, when the person is having the influenza, he shows these symptoms like body aches, fever, sore throat, headache, dry cough, fatigue, nasal congestion, and it is transmitted through the flu viruses when the cough or sneezes, almost similar to the corona. AIDS, another important dreadful viral disease, which is once it's getting affected, the person shows the following symptoms. Like, the very important thing is that immune system is going to be destroyed, and this is through the sexual contact. Then chickenpox, when it is suffered, then we can see the skin rashes on the body, and this is going to spread through the respiratory droplets when the cough or sneeze comes. So like this, we have a lot of other viral diseases which can cause to the human body, and how actually it is going to be transmitted here. Next, the very important, the present aspect scenario, and today what we are facing, the problem is because of coronavirus. You can see the image of this coronavirus, and those red structures what you are going to see is none other than the fatty layer which we see on the surface of the virus. Now, the symptoms of this COVID-19 are fever, cough, that's what already I mentioned, shortness of breath or difficulty in breathing, chills, muscle pain, headache, sore throat, then new loss of taste or smell, congestion or runny nose, what I explained already, nausea, diarrhea. So all these are the symptoms that tells the person may have corona. If he shows any one of these symptoms, that the doctors may suspect that he may have COVID-19. Then, what precautions you have to take to protect from this COVID-19? So the very important thing, as you are already aware of that and you are all following that particular thing, is maintaining the social distance. Then wash your hands with the soaps and the water regularly. Whenever you go outside, whenever you come back, you have to use the sanitizers. So you have to wash your hands with soaps and water regularly. Then at least use a sanitizer which contains 60% alcohol. Wash hands, and before you touching the eyes, nose and mouth. Don't touch the eyes, nose or mouth after touching to any other objects. Use the tissues into closed bins immediately after the use. Then very important precaution is we have to wear mask. That is very important. Then cover your nose with a kerchief. If you don't have a mask, you have to use the handkerchief, or but better, we have to use the mask. Maintain the social distance. Then use hand sanitizers, which prevents the coronavirus till we get a medicine for this. So with this, we complete a few aspects of this chapter. We shall meet in the next class with some other aspects of this chapter. Thank you.